It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And today, Dr. Hotze is going to be discussing with Dr. Donald Ellsworth the new and exciting trends in IV therapy. Dr. Hotze.
Thank you, Stacey, and thank each one of you for joining us today on Dr. Hotze's Wellness Revolution. Remember, I believe that you and everyone really needs to have a physician and a staff of professionals who can coach you onto a path of health and wellness naturally. So as you mature, you've got energy, vitality, and enthusiasm for life. And that's what we do here at the Hotze Health and Wellness Center. Today, I'm visiting with one of our lead physician here at the Hotze Health and Wellness Center, Dr. Don Ellsworth. Dr. Ellsworth has been on staff here for approaching
16 years.
Is it only 16? I thought it was, yeah. So anyway, he's got the seniority and has done a great job. He's a physician scientist, so he does a lot of studying and research and brings a lot of new ideas into our practice. So we're glad to have Dr. Ellsworth with us today.
Thank you very much.
Dr. Ellsworth, by the way, in his past training, after he became a physician, went to work at for the Air Force, right?
I did.
And how many years were you in service?
4 years.
4 years as a physician in the Air Force, and then you and your family did some Christian missionary work as well.
We did. We worked over in Central Asia for a spell.
Yeah, which had to be a different life experience. I'm sure it was, wasn't it?
It was very good. You had to get back to the basic sciences there because they don't have a lot of equipment.
So what we want to talk with Dr. Ellsworth today is about IV therapy. That's intravenous therapy. And we offer it here at the Hotze Health and Wellness Center, several different modalities and several different IV treatments that can be helpful for a host of conditions. And there are some that we already have on track that we do here at the Hotze Health and Wellness Center. There's some additional IV therapies that we've investigated, some we brought online, some we're going to be bringing online in the future. So I thought we'd start maybe with the basics, some of our basic IV therapy with IV vitamin B, IV vitamin C, glutathione, ALA, alpha-lipoic acid, and some of those. So explain to me what we would use our routine IV therapies for.
It really depends on the conditions, but if somebody says, I just am kind of run down, I've been traveling or I'm about to travel, can you give me a pick-me-up? The routine vitamin IV, which is similar to the Meyers Cocktail, has the B vitamins that are necessary for energy production. It has your vitamin C, gives you the magnesium. So it's a good load of the key vitamins you need. And a lot of people feel more energy just after that. It's very simple.
In this vitamin C, I'm a very strong advocate, as you all know, of vitamin C and taking vitamin C for a host of conditions. Vitamin C is a wonderful antioxidant, which means it gets rid of bad molecules that are negatively charged that can damage your cells. And so it's a great antioxidant. It also is necessary for the production of collagen. Collagen is what is the glue, the protein glue that holds our cells together. So if you pull up your skin, it doesn't pull apart like tissue paper, it goes back. You've seen people, though, with poor nutrition, maybe people that were alcoholics or they had poor nutrition, their skin is all bruised up. That's a sign of scurvy, low levels of vitamin C that can't make collagen. And vitamin C is very important for coronary arteries to keep them healthy, and helps prevent coronary artery disease. Vitamin C is also in high doses antibacterial and antiviral, so it can be used when people have significant infections. In fact, I followed Dr. Tom Levy, who talks about curing the incurable with vitamin C. It's also a wonderful antitoxin drug, so it can be used. Or antitoxin vitamin. It can be used in high doses, 50 to 75 to 100,000 grams. If you think about that, normally the normal capsule is 1 gram. So giving it in high doses can be very effective in certain infectious diseases. And Dr. Levy and others have used that effectively, and we use that here for people that have the flu and other diseases as a adjunctive modality in helping them build up and strengthen their immune system. Vitamin C is very important for strengthening the immune system and also for strengthening the adrenal glands. Vitamin C concentrates in the adrenal glands about 100 times the strength that it does in any other gland. So it's very important for adrenal function. So we do have vitamin C IVs, and we use those in combination with B complex and magnesium. Also, we have alpha lipoic acid. Let's talk about that a little bit and what that's good for.
Well, alpha lipoic acid is a fantastic antioxidant, and it's very good at helping the immune system work properly. And one key thing that alpha lipoic acid is useful for is helping the liver. So if someone
detox,
someone is dealing with a lot of toxins and has some liver problems, alpha lipoic acid can really help lower the liver enzymes and help restore liver health.
And so we use that. We have ALA IVs, as well as oral medication. But to really get a boost, you want to use that. If you're having problems and liver enzymes are high, even people have used it, doctors have used it in cases of hepatitis and cirrhosis even, and have used it effectively. There are case reports on that. So ALA is very important for overall immune system strength and detoxification. We also use glutathione. Let's talk about that a little bit. Glutathione IV, which we also have by oral medication in the vitamin store.
Glutathione is our master antioxidant. It really pulls out the toxins, and we use up glutathione when we get rid of toxins. When we ingest something like Tylenol, acetaminophen, every time you excrete a molecule of acetaminophen, you take out a molecule of glutathione, which is one of the negatives of these medications, by the way. Acetaminophen uses up a lot of your glutathione. And when you get low on glutathione, you can't detox, and it even increases your risk of health problems like asthma.
So glutathione is an important antioxidant, and it's regenerated by another supplement called N-acetylcysteine. So we give that in our oral regimen. We'll give N-acetylcysteine to help the body regenerate glutathione. Now, those are some of the standard IV therapy that we have here at the Hotze Health and Wellness Center. Now, you've heard us talk about stem cell therapy, and stem cells are the pluripotent basic cells that can turn into any other cell in your body. That is the original cells that can turn into bone, that can turn into heart muscle, that can turn into cartilage. And our body has stem cells, and you find them in two primary locations. You find them in the bone marrow, and these are primarily hematopoietic stem cells, which will form blood, red blood cells, white blood cells, and hematopoietic substances for the blood. Another type of stem cell is mesenchymal stem cells, and those can be derived from other sources. One key source is fat. You can take fat from the belly, and you can extract out the stem cells and then grow the stem cells, and you can put them back into the body. You can put them in locations in the knee, or you can even give them IV. Interestingly enough, there was so much research done that everybody thought the reason stem cell therapy did so well is because they thought the stem cells were becoming that particular cell that was damaged. So if you had a heart damage, you put stem cells in there and it regenerates heart muscles. If you have cartilage damage in your knee, you put in stem cells. It was thought that the stem cells became the new cartilage, when in fact that is not the case. The stem cells are much like a refinery. If you think about down on the coast of Texas, all across the Gulf Coast, we have multiple refineries that process crude oil. That crude oil is refined and converted into multiple different products: gasoline, diesel, butane, ethane, propane, a whole plastic products, a whole host of products come out of the refineries. And those specific products go to the industry where they can be used. When you drive up to a filling station, you go and there's a pump there. That pump is connected to the gasoline that's been stored underground. You don't want the pump in your car. You want the gasoline out of the pump. So think of the refinery or the pump as simply the stem cell producing products. The products that you want are the products that come out of the refinery or come out of the pump into the car, the gasoline. And so that then drives the car. Well, it turns out the substances that are secreted from the stem cells are called exosomes. And they're contained in lipid vesicles, and they're literally thousands of different molecules. They're growth factors, they're anti-inflammatory products, they're products that stimulate anti-aging cells, and a host of other things that they do to help the body regenerate and rejuvenate itself. And it's the exosomes that come out of the stem cells that are what communicate with the cells and cause the cells to heal. So it's the exosomes. Now, to be able to get exosomes is much easier than to be able to get stem cells themselves. Now, mind you, the stem cells have come under some restrictions by the FDA. You can take stem cells out of your fat and you can inject them into the body within the same day, and there's no problem with that. But if you take those stem cells and you expand them by growing them on Petri dishes and going from 1 million to hundreds of millions of stem cells, the FDA says you can't use those anymore in the States because they're now a drug. Interestingly enough, they're still stem cells, but because they've been manipulated, the FDA just says they're a drug, and they won't let them be used. So there are some companies that expand the stem cells, like Celtech, and you can grow your stem cells here in the States, but you have to go out of the United States, to get the IV therapy with the stem cells. That's a very expensive proposition. Now, there are companies that simply take the exosomes, and the exosomes then can be given intra-articularly in knees, joints, where you have some osteoarthritic problems, or they can be given IV. And these are derived from placentas, and they're derived from umbilical cord, and they're acellular. They don't contain any stem cells. There's no antigenetic risk. They simply contain the very products that the stem cells produce. So I just attended a conference recently on this and have been studying this over the last several months, and it looks like this is a real wonderful opportunity for us to offer here at the Hotze Health and Wellness Center, an opportunity to have the benefits of stem cells without having the stem cells themselves. We simply get the products of the stem cells and give those in the appropriate location, either IV or intra-articularly. So I'm excited about that. And I wanted you to know that this is an adjunct of stem cell therapy. It is stem cell therapy without the stem cells. It's refineries without the refinery. It's the end product that your body needs to help your body heal and rejuvenate itself. We have some other IVs. We have NAD. Let's talk about that.
Well, NAD is nicotinamide adenine dinucleotide, and it is interesting that particularly when given in an IV form, it can reestablish the balance the body needs. And it turns out a lot of the degenerative diseases we see are in part related to a drop in NAD. And it's an up-and-coming area. There's been articles published in journals talking about how the decline in NAD may be one of the major factors for a lot of neurologic diseases, Parkinson's, for example. And there's some encouraging results when folks have been receiving NAD, particularly in an IV form, where they're able to see some reversal of their symptoms. So it's all very encouraging. But a lot of people receive NAD for the energy benefits.
And let's talk why that's important. Remember, I've talked about the power plants, and that's your mitochondria. And NAD is very important in the production of electricity within the mitochondria. The mitochondria is your power plants, remember? Your cells all have power plants called mitochondria, some thousands of mitochondria. And the mitochondria produce electrical energy, and that electrical energy is carried to the cells by a product called ATP, adenosine triphosphate, and that those electrons really drive all the biochemical processes within your cells and within the organs. So you want to be a high voltage individual producing a lot of electricity, a lot of energy. Otherwise, you're going to be a brownout. And you know what a brownout is? It's like when the power plant in the area doesn't produce enough electricity, then everything gets brown. We get low levels of lighting, or we get flickering, or the lights turn off. Well, we want our power plants to produce high levels of energy, and NAD is one of the ways. As we age, we lose NAD, and so we put that back in our body, and that stimulates energy production, which helps. When you have high energy, good metabolism, everything works a lot better. Brain function, cardiovascular function, liver function, everything, all your muscles, it's very important. So we do have that therapy, and we're using that right now.
We do, and it's interesting. It looks like just even if you're otherwise healthy, taking it for anti-aging purposes has benefit. But people have been using this for a wide range of problems, trouble with sleep. Some people with type 2 diabetes have seen their numbers improve. Even in the addiction world, folks with opioid addictions, alcohol addictions have found that their cravings will start to recede and their mental function will return. That's obviously very hard on your body to be abusing it that way. And their mitochondria get very unhealthy. So restoring NAD is a very helpful tool at restoring health.
As we age, of course, part of the problem is we're exposed to toxins, and that would be the petrochemicals in the environment, things we eat, breathe, drink, slather on our body, heavy metals, and sugar, food with sugar content all have a very high inflammatory content, and they down-regulate our power plants, our mitochondria, and they don't produce enough energy. So what we recommend is a good detox program and using some of the things we've talked about, either oral or IV glutathione and alpha lipoic acid, vitamin C, B-complex, to help you detoxify, get yourself on a good healthy eating program, do IV therapy if you really don't get well enough with your oral supplements. We can do IV therapy for acute illnesses as well. And there's another product that we're looking at having here, and that's PRP, which is platelet-rich protein. And you get that from just drawing off a guest's or patient's blood, 10, 20 mLs, and you spin it, and it spins down the red cells and the white cells, and you're left with serum. And that serum, which is protein, contains platelets and platelet-rich protein. And that has salutary effects too, and that can be given intra-articularly as well as it can be given intravenously. It's used by a lot of orthopedists in joint injuries and osteoarthritis and other type of arthritic problems. Finally, one other IV modality we're going to bring in is chelation therapy, and let's talk about that. Tell us what chelation means and what it is and what it does.
Well, the root word has to do with grabbing something, and it's from the word claw. And these are molecules that can grab metals in particular and pull them out. And EDTA is the main one we'll be using. And doctors have done this for quite some time, but thankfully now we've actually had some studies completed that have looked more into the effectiveness of chelation therapy. Not only can you use it to remove heavy metals, but another purpose has been those with coronary artery disease, those who have angina, or they're just trying to prevent a problem. There was a study called the TAC trial, which is the trial to assess chelation therapy, and it showed a fairly significant reduction, particularly if you have diabetes. The benefits were rather striking. There was a 52% reduction in recurrent heart attacks and a 40% reduction from the death from heart disease. Again, that was in the individuals who were dealing with diabetes in the background, not just heart disease. So especially in that population, boy, those statistics are really impressive.
And in the chelation therapy, again, it grabs the heavy metals and pulls them out. And we mentioned to you the heavy metals, and all of us are exposed to heavy metals, particularly mercury. I mean, the dentist put mercury amalgams in your teeth. If you have them, take them out. If you got kids, don't let them put in. There are all kinds of other substances they can put in when they have fillings in your teeth that don't contain any metal, particularly mercury. Mercury is highly toxic, and you sure don't want that in your mouth. And I don't know why they allow that, but they have. So mercury can be very toxic, as can lead, as can aluminum. People cook in aluminum pans, and you get aluminum in your system, which has been shown to be complicit in one of the causes of dementia and Alzheimer's disease. So you don't want these heavy metals in your body because they cause inflammation. And inflammation leads oftentimes to coronary artery disease. And what you want to do is do a chelation therapy, particularly if you've got calcification in your arteries. You want to suck out that those metals, and you want those metals in, they'll be urinated out, and you'll get rid of them. So chelation therapy can be very helpful. Those are the things that we offer here at the Hotze Health and Wellness Center in the way of IV therapy and upcoming IV therapy that we're going to be doing. We talked about our standard IV therapy using B-complex, vitamin C, and magnesium IVs like a Meyers Cocktail. We do alpha lipoic acid and glutathione for detoxification and strengthening of the liver. We're also looking into Exosomes, which is the product of stem cells to help regenerate your body, to help your body heal itself, to help cut down on inflammation, and really produce a healthy system, much like stem cells were thought to do, but they do it because of the exosomes. And then we have NAD therapy, which strengthens the mitochondria, and we've got chelation therapy to suck out the toxic metals in your body to help your body heal. Was there anything else I mentioned that?
No, that covers it.
So anyway, our goal here at the Hotze Health and Wellness Center is to help you get on a path of health and wellness naturally. We believe that the body's got amazing restorative powers that God's given it. And if you put the right molecules in the body that are natural, and you take out those toxic products that you may come across in your environment, which you're going to, then the body can heal itself, and you don't use pharmaceutical drugs. Remember, pharmaceutical drugs are all toxins. All of them are toxins. They have to be detoxified by the liver. So they're basically poisons, and we don't want to do that. We want the body to heal itself naturally. There's no way you can possibly poison yourself to good health. We know that. So I want to thank you for being with us today. Thank you, Dr. Ellsworth, for your insight. We appreciate it. And God bless each and every one of you, and look forward to being with you again on our next podcast.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.